So I'm so excited to be here. I have had the privilege of being here maybe once a year for a few years based on the other work that I'm doing, and I really feel like UHN has welcomed me with open arms. The province of Ontario, all of the transplant centers, the community nephrologists, the dialysis centers, the people making a difference with patients, and the patients have been so welcoming to me. And so I want you to know I am so here for everyone in this room and all of the things that you want to make happen today. All right, well, I would like to talk about something really interesting. Okay, so I came at the end, and I want to say, first of all, really where my Transplant Research and Education Center stands is, I think, in this dialogue that we have today, that our lab, we're committed to understanding and overcoming the critical modifiable barriers to affecting transplant rates and outcomes. So I'm in a search for what is modifiable and how do we move the needle. And I want to also say a big welcome from the Terasaki Research Institute. This is a really exciting innovation think tank focused on transplantation that's out of UCLA, based on the gifts and the legacy of Paul Terasaki. And so we all are working together to say, where can we go out of the box, not play it the same way, the safe way, and see if that can change the game, as Paul Terasaki did. So I want to say in the fastest way possible where we all are now. So we all know that if people who can get a transplant, 5 years later, they're going to be alive. And that's what we want for them compared to remaining on dialysis. There's probably similar trends. But we also know that this is the pattern in terms of access to living donor kidney transplant. We know, and I know you've been hearing this all day, living donor transplant rates are declining in Canada. We also know that there's a gap just increasing in disparities in access to living donor transplant. And this gap is present in America. Looking at 1995 to 2013 in our most current data, you can see this gap widening where the top curve are the white patients and everyone else is below, getting worse. The pattern is the same way in the Canadian, almost the identical pattern. So if we do not change the way we're playing this, we're going to be just living this pattern. And I think everyone here is already saying, I love your comments. We're saying, what do we do differently? And this institute is so exciting because there's an opportunity. So they're disparities recommendations in consensus conferences. And they say things like this, and these are good things that we are implementing. They say we should be implementing culturally tailored, community-based education, right? Get to the people, speak in their words. We need to be engaging transplant liaisons or patient navigators to work in the communities. We need to use living donor champions to educate patients. I have no problem with this. And 10 years ago, even though I look young, I'm getting old, when I was a little bitty person, I said, okay, we need to do this. If we can build all of these things, it will make a difference. Okay, I think we all feel that way. So I want to tell you about a study from somebody I profoundly respect. Rachel Patzer works out of the University of Emory in Georgia. And she said, okay, we're going to implement all of this to reduce disparities in access to transplant in our dialysis communities. We are going to develop a partnership, an intervention where we put dialysis, transplant, community partnerships together. We're going to do quality improvement plans. We're going to do better education. We're going to do reports on what is happening. Patients are going to get involved, and we're going to have the best decision aids available. And she worked, and I want to say that no one could have done it better. Years later, she published the paper on it. The transplant evaluation rate for dialysis patients went from 5% to 8% out of this kind of community intervention with so much work, so much money. And again, what's there for me as someone who is so passionate about this is it's going too slowly. I don't doubt that the people that benefited and that things moved. But if this is what all of our efforts are going to do, like, how do we think differently? And you know this quote, insanity is doing the same thing over and over again, but expecting different results, right? I feel like we need a paradigm shift. Like to say, well, we're going to do a little bit better education with a little bit different community. And I want to also say that I am the proponent that 10 years ago said we need to do better education with different communities. So I'm speaking against myself 10 years ago. And I'm saying, where are we not as effective as we could be? So the other part is, what can we do to overcome disparities? And for these people, which are so many and so different with so many barriers, those with poor knowledge, those with questions and fears, those who can't drive to a center, those who don't know how to find living donors, those who don't trust their doctors, those who've never met anyone who looked like them who ever got a transplant. What about someone who's never met a living donor in person? Those who speak languages other than English, those who didn't get a lot of information before their kidneys failed. Maybe they hit crash start. They woke up one day and their kidneys failed. They're totally disoriented. What about all those family members and friends that live in other provinces that can't come to the appointments to learn with them? And what about the people who are like, maybe, I might be a living donor, but I have a lot of questions, right? That's what our gap right now is not touching enough. And for many of these people, the road ahead for transplant is closed. Now, going back to the focus of this conference, if we look to see, are there racial differences then in people walking in the door that are relevant to this? The answer that we're seeing at UCLA is a resounding yes. For patients who walk in on day one, the level of knowledge about living donation and transplant for Black and Hispanic patients in our clinic on day one is significantly lower. Their preparation, whether they have watched information online, whether they've read anything before they walk in, is lower. In general, it's low if you really look. And finally, are they talking to people? Are they engaging in living donation actions? Do they have people backing them up? Again, Black and Hispanic patients are lower. So we've got our work cut out for us. So I want to talk about disparity change. This is my one geeky data slide. Don't worry, the rest is all stories. But what I want to say is, what are the patterns in which we can change the game? Okay? So this is what I think we all want in the ideal. If you think back at the white patients, they would be in the blue line, right? That over time, that they are more likely to get living donor transplants. But what we're also trying to figure out is what's happening with the red and the green line, which is all of our different communities that are getting less access to living donor transplant, and how can we catch them up? Does that make sense? All of the research, probably when I say all, there'll be like 6 studies that are not that. So with a star that it's not all. The majority of studies right now are showing that when you put interventions that reduce disparities, you have the white patients benefit, and then usually the other communities also benefit, but the gap does not reduce. Make sense? Okay, this is the worst pattern though, where you do an intervention when the white patients benefit and you actually make the disparities worse, where the program is totally not in the listening of the other communities and they're turned off, or this is not a resource that they can take advantage of. So we definitely don't want the third option. But again, going back to what's missing, I keep thinking about this first box, right? We can increase everybody's knowledge a little, but if you're already starting off in the back, how do we help you catch up, right? And knowing how amazing our professionals are, there's a lot of people we need to catch up. So I want to go to a quote by a leading patient advocate, Dave DeBronkart, and he says this: "Please, let patients help improve healthcare. Let patients help steer our decisions, strategic and practical. Let patients help define what value in medicine is." And I'm being with that. You know, we're in a world of patient engagement. We have the amazing TAP program here, the Transplant Ambassadors program. Somebody was up at the podium here. Patients are here to contribute to the education happening in this province. And we always look at the patients being in the middle, right? We say there's a patient we need to support them, maybe they're donors, and then the organization, we need to do a really good job. Possibly a lot of the things we're talking about today are in these first 3 circles. Well, I'm kind of wondering, and I think we're already hearing the value of health policy change. That's been named in the room, but I'm intrigued by this circle, the community circle, the media, the community organizations. Where is the work we're doing in our core? How could that be supplemented more effectively and cost effectively by the community band? So is there anyone here that would say, hey, I'm part of the community band in some way in the work that I do, or I have community organizations that I'm affiliated with? Okay, great. Great. And I love everyone, and I'm part of the middle. So I'm no slam to the middle. So if we think about this community band, the world outside of transplant centers, and I want to say something because this showed up in the room. So if 1 out of every 5 people are actually eligible to be a living donor, before I go here, we're going to have to widen the net. is what I would say, into the community to try to find more people who could be tested, right? My sense with UCLA is that it's predominantly health reasons why people are ruled out. It's not that they drop out. So we have to find more people who are healthy, who are motivated. So, okay, so now we have to widen the net, right? So where do you think people hear about living donation the most now?
Somebody who's famous.
From somebody famous. Not from the TAP program?
They appeal for a transplant. Eugene Melvin.
Okay.
Ottawa Senator.
Yep.
Is a great example. But there are all sorts of movie stars.
Yep. Selena Gomez in the US, right? Grey's Anatomy is another place. Yes, so I would say you're right. Media, right? Grey's Anatomy, the story of the day, right? Somebody's getting harmed and someone's in love, right? Yes. So this is currently, the media is actually moving the needle more than any of the work we're doing internally. And, you know, the world is become the media world. Now, in a perfect world, what I would hope is that the people that are hearing about living donation would be hearing about living donation from people who had lived it. And I always think of stories of women newly pregnant who talk to women who've had kids, right? What is it like to be pregnant? What is it like to give birth? How painful is it really, right? This is part of our society of like find the wise sages and bring our fears privately to them and have them say, yes, I had the same fear. And then, okay, how do I deal with it? Or what do I need to do to be able to deal with the pain of childbirth? And, you know, and then they're like, you'll forget it. And then like, I'm scared, it doesn't matter. All of that space. So here's what I'd like to propose. So these are great interventions. I have no problem with them. We should keep doing them. But I'd like to propose that we add one more. That we amplify patient and donor voices to share real-life living donation kidney stories and empower each other in the process. And so going back to why storytelling works. So remember all those people, all those different groups left out of our current work, right? So the first place to me is it gets people curious. And the thing that's amazing about the fact that I'm launching this with you guys today is that the way I got into living donation is from one story by one donor. Do you want to know what it is? A donor, I was surveying people, I was a little grad student, and I was surveying donors about whether they regretted their decision and whether it cost them any money, all of the risks that we are concerned about that are valid. And one donor said to me, I became a poet after I donated my kidney because I got what life was about. Sometimes you hear something and it echoes so profoundly for you that you can't let go of it. And I was like, what is this thing? That they get what life is about? What are her poems about? Who is she? What is this field? And the field opened up. So it got me curious. And if people are effective storytellers, it gets people curious, even people scared and people thinking this is not for me. The second part is that I am a psychologist, that's what I do for a living, and my feeling right now is that my voice is great. I try to make a difference through my voice, but I did not live this story. To hear the stories of donors and recipients telling what they think is important without me censoring them, that they get to speak to their community without healthcare professionals is a missing space in our field. The next thing is that it's gentle. For all those people who are like, I am not going to find a living donor and you can't make me do this and I can't accept my daughter's kidney and all those things that we're grappling with, could you just hear a story? People could do that. It's also about emotions, not just facts. So I have great health literate education. Many of you guys have education you're presenting. But what about the emotion of this field and this vulnerability of this field? That has got to be honored. And finally, it culturally grounds the messages. It allows people to talk in ways that are comfortable and organic for them. You can see someone who looks like you. So people have started to use storytelling in other health areas, and it's been shown to improve many different healthcare areas. But it's a complex thing and a messy thing. But what I like about it too is it's not about replacing health education, it's actually about supplementing it. That you could have stories be part of something and then you could learn the fundamentals. It's not about saying you shouldn't make an informed decision knowing risks, but let's see if you care one way or the other. But the other part that's had me be an innovator about this is what I have seen in my clinical experience is that wonderful support network programs like the Transplant Ambassadors Program have a lot of complexity about weaving into daily care and meeting dialysis patients and getting in and sitting across from them to share their story, right? It's hard to find somebody who's available at 6 a.m. to come here and do this. Then there's a lot of hospital-related regulations and all of these things. So that has been difficult. And there was a lot of promise with this smartphone app that Andy Cameron and his team at Johns Hopkins created, where they created an ability to increase live organ donation that was very successful, that helped people type in that they're looking for a living donor kidney and post it to Facebook. Okay? Love it. It worked. It gave people tools. Very, very promising. The problem is how many of our patients, especially the patients we're trying to reach now, are comfortable right now soliciting for a living donor kidney. That's great, it's just way out here. I want to have people learn. I want to have people connect and get curious. But he pointed away. And the thought was, how do we utilize technology in an easy way for people to help patients connect with others, to help providers tell their stories? So I went to work. Oh, one more thing too. So I've had the privilege of working with Dr. Mushi to build Explore Transplant Ontario here. And we filmed in rooms here and people came in and they drove and they did all of this stuff. And it's expensive. So how do we make it low cost, right? And easy, especially if you're not feeling well, to get to be at home, sitting in a comfortable place, talking about what's important to you. So what we've been able to do is build a living donation storytelling library, an online library that is available now, that I wanted to invite you at any point after this to go to. It's at explorelivingdonation.org. And we launched it in the US on April 13th of this year. This was a labor of love. I thought, I wonder if anyone will tell any stories. I wonder if they're gonna be good. I wonder if they can deal with technology. And I was like, but these stories are profound, so I'm committed. I want to say also, we're launching it in Canada today. So do you want to see a little bit about what it looks like?
My name is Katie Walker.
Hello, my name is Richard Hicks.
My name is Matt Ronan.
My name is Susie.
Emily.
My name is Diane.
And I donated a kidney to my cousin.
And I donated my kidney to my brother Carl.
I donated a kidney to a stranger.
I had the honor of donating my kidney to my daughter Monica. She was 3 years old at the time.
I was motivated to donate a kidney to my brother because of, one, what he was going through, and two, that my brother needed a hero.
It was really powerful. It was a powerful moment to see somebody go from so sick to looking so much better in such a short period of time.
It was, words just can't describe it. She just and her color was back. And she looked so good.
The best moment after my surgery was on a Saturday. My brother came downstairs, I was eating breakfast and kind of doing my thing, and he said, "Bro, guess what?" And I said, "What?" And he said, "I don't have to go to dialysis."
I would just encourage you to remember that a very short interruption in your life, a matter of days or weeks, can make the difference in the rest of someone else's life.
Okay, so let me show you what it looks like online. So basically, this is a website where, let me walk you through it. So up here, these are all real people's faces that are cut from the videos. There are stories similar to the one I just showed you. You can cut this video footage in a lot of ways, but the key for me as an ethical person giving the space for the patient voice is my goal was not to cut them, to give them their voice, right? Whatever you wanted to say on this, but to make it as easy as possible. We have donor stories first. Why would someone donate their kidney? Luther here over in the corner gave his kidney to his daughter right there. Recipient stories. What was it really like to be a person who received a living donor transplant? Tell your story. Friends and family. I think that people don't know that living donor stories affect everybody. So this is a fact of these powerful champions, these wives who went through this holding their husband's hand and somebody else donated talking. It's amazing. You have people in need of a kidney. This allows people who are in need of a kidney to share a story and then to even post it to Facebook. And then there's me. I actually film my own story awkwardly to say, here's how you use the odd foot, the process. So I want to show you how we do it. So let's see. Oh, good. Comes back. Okay, so how you do this is you get a phone and you go online and you get a series of prompts that say something like, when I started to learn what kidney failure meant or was like for my recipient, I was surprised to learn that. So we start them off in ways that people are curious about the educational answer to what they're saying, but that I don't know what they're going to say. They also choose the prompts that they want to talk about. So there's a lot of possible prompts, and you could say, I want to tell you about these 2, or I want to talk about these 11. They click the ones. So the prompts are their starting jumping off point. Once you pick your prompts, you get a screen about I want to record and go to the camera, and you get this screen that leads to a blank screen, so you're talking to a blank screen, and people start building their stories. What I love about the technology behind it, the biggest concern for me with an older population is, you can film your story on your phone now, but to say everything perfectly, and you get a phone call and a text in the middle, and you don't like how you said that first part, all those challenges, because you're telling answers to different prompts, you talk until you feel like you've said that the way you want. If you don't like it, you refilm it. And at a point where you approve it, it moves to the next prompt. At the end, the software slices it all together as if you were a perfect sharer from beginning to end. Yes, thank you. I credit the technology people on that one. Yeah, I would love for you all to try it. The other part I love so much is we now can show that this is a health area that is touching and changing the lives of people who all look very different. This isn't beautiful white people who are insured. This is humanity, right? So when you see all of these, you can actually, I'll tell you something in a second, but we also go through an ethical review where I was talking about it with my Jed, an ethicist here, and we were talking about how we just want to make sure that there's nothing that if you had a lot of exposure or if you inadvertently broke someone else's, private information, or there's misinformation. We've been doing a lot of work to make sure that. Other than that, though, we don't censor anything. We just want to make sure that the stories, there's not medical inaccuracies getting released, but say what you want. So we're doing ethical review of these. But then what I love is you can sort. So if you're somebody who's like, would I ever do this? Well, let's look at another woman who lives in somewhere and who it looks like me. And I want to hear somebody whose mom offered to donate to her, right? So can you imagine if we just had like a library full of stories of people who looked every which way and had all of these different experiences? And so this has been great, but I want to say for our launch, we now have a Canadian one with 6 stories in it. So let's make more than 6. The other part I'm really passionate about is that this can be a way for people who are interested in finding living donors to get to organically say their case or their champions. So I could say I'm a mom of a daughter who needs a kidney. Now you have the technology, and now all we do is make sure that there's nothing offensive and it launches, and then they can say, go to my story and hear all about it. The other thing we've seen happening at UCLA is that people say, this is a story similar to me. So they don't post their own story, but they post a story from somebody who, is resonating with what they would like to say. So we have now it's been fascinating. So we've done a lot of research about who is joining the storytelling project, and I was like, I hope people will want to tell their story. People have been so generous, so vulnerable. I'm very moved by reading and listening to the stories. We're still getting a racial disparity. So white patients are more likely to want to do this. I would actually love to add liver as one of the storytelling experiences into this. But we're still getting people to do this. I was also wondering how difficult the technology would be, because understandably, I have trouble with technology. So it's interesting, a lot of them say it's easy, but the experience that we've had is we need to support people who are learning how to use the technology and getting through this because even though that they're at home. When they sit, most people didn't experience any challenges. But again, you see the charitability of people, and they say they want to educate others. The people doing this want to educate the public, they want to spread awareness, they want to help more people become donors, and they need some help dealing with both technology barriers, but also any emotional barriers where it's like talking about this is upsetting to me. There are people who cry on the videos, there's people who are touched and moved. So we as a lab really looking at this for the first time want to make sure that everybody who's doing this have what they need and get to say whatever afterwards. Now, but this is where it could explode. What are the opportunities for a video program like this? So here are some ideas. So actually before, what do you guys think? I'll tell you what I think. Do you have any thought? So you can just say it, or you can type it into your Sligo or whatever you want. But do you have an idea? Hey, a storytelling program. I know a value of it. Could you see anything that comes to mind before I tell you my ideas? Any ideas that come to mind? Share? Yes? Tell me more.
Sharing all those information and post it, and then hopefully we can just turn on this screen to all the patients when they are on anywhere.
Yes, yes. So clinically, you could see a place clinically. Like where would you see that somebody might watch these stories? When they're when they're waiting, anywhere. Yes, anywhere they want to wait. Yes. Yes, I love it. Yes, other ideas. Great. This is the group figuring it out for Ontario. Other ideas you guys have? Anything that you're up to? Yeah?
Very safe. We could run it in our waiting rooms at the hospital. People are waiting to see the doctor.
Definitely. Yep. Other thoughts? Yeah, somebody over here? Oh, in subways. Okay, great. Like marketing campaigns places? Yeah, get somebody who just says the beauty of living donation. Oh, love it.
Create a site in media, like every day, 2 o'clock, radio has 5 minutes for transplant stories.
Ooh, so that this is a place immediately just to get content that's real that people have released and then put it in a public service announcement or a TV story. Yes. Yep. Great. Other things that are here just in your bubbling, because this is why I'm here. I'm not here to tell you how to. I'm here to invite you to play with me, right? You guys know things I don't know. Other? Yes.
Use it during the World Kidney Day or any such event.
Yes, any particular focus day, post all these, right? Hundreds and thousands of stories. Yes.
Medical school.
Ooh, okay, tell me more what you would think.
Give medical students a chance to see some of their patients and what they experience.
Love it, love it.
Can we ask famous, very famous people in different areas?
Yes.
Just promote this in their Facebook, whatever.
Have them tell their story and then promote it, right? Can you imagine if these famous people that we just started with could be in this library? So everyone's coming to hear their story and then they see everyone else and, oh yes, love it. Okay?
Among non-directed donors, there tend to be trends around the history of volunteerism and get screened for it in the process. And so tapping into volunteer centers. So many people who volunteer, say in Ottawa, come into Volunteer Ottawa, and there are thousands upon thousands of people who visit that website and then start to receive emails and follow on social media. So tapping into knowing the kinds of people who sign up to do that, where else do you reach them?
Yes, love it, love it. This is great.
On the highways, we have a thing called en route, and they have TVs in there. And I'm thinking of like doctors and dentists because we need to go where transplant recipients aren't, where living donors will be. So not people who are in the hospital or sick, but people who are traveling. Tim Hortons has a TV in that as well.
Fabulous. Whoa, it's popping. There's popcorn here. What? School, okay.
People get the information, they might transfer the information to the parents, the friend circle, it could be spread it.
Yes, young kids, like this is interesting. If you got kids that have gotten transplants and you have this kind of stories of kids in their life, yeah.
It's not so much where to show it, I was thinking, but what resonated with me is, you know, it's always very moving when I go and visit a recipient after they've had a living donor transplant, and it's right, the color, their eyes are brighter, you just see that, so it might be a really nice idea for a few people to put it before. like I'm having a transplant tomorrow and then do a follow-up video a week later.
Ooh, yes, you could do, right, capture the, this is my life on dialysis. I'm hopeful that I might get a transplant. This is my life afterwards. Connect them. Yes, keep going.
I'm also thinking that who better to hear from about improvements, systemic improvements, than people that are actually living it.
Yes.
And that there should be an opportunity or a prompt for what would you like to see differently. There needs to be a section to really inspire and motivate change. There's got to be the ask. Wouldn't it be great if donors were followed up after their transplant experience?
Yes, love it. Great. So you see, I'm glad you resonate with it because this, I was like, this has every different direction. So what I want to show you now are some funny, amazing things. So I've mined the data for you a little bit. And what I want to do is show you some 1-minute little clips, not to, just to spark your creativity even more. Okay? So let me show you. I think some of these are already showing up.
My name is Claude.
I am Valentina. I live in Canada.
Hi, my name is Ariel. And I received a living kidney transplant from my sister. That was almost 5 years ago.
I did peritoneal dialysis until I got kidney transplant.
And I received a living kidney donation from my sister just over a year ago. I could really feel a decline in my energy level. I remember feeling tired and cold most of the time. And within a couple of weeks, I could no longer climb one flight of stairs. I had to stop in the middle as I was short of breath. Depression hit me hard, and I was so ashamed to tell anyone. It was joy, but it's more than this.
I feel so amazing. I feel like I was born again.
I started to feel like the fog was lifting. I'm especially grateful to my sister who selflessly gave me a part of her in order to save my life.
I'm just going to show you a few.
The best moment after my surgery was when the doctor came in and told me that my friend who was in the room next to me had just peed.
Another good moment after surgery was the first time I urinated, because that was another little fear I had, like what if I never urinate again normally?
His exact words were, your kidney was peeing all over my hand before I could get it attached to the ureter.
The absolute best moment after my surgery was finding out that my recipient was, in the words of my husband, peeing like a racehorse.
Life is just about eating and peeing. You know, by the end of dialysis, I barely could pee anymore. And so just to be able to do that was like a gift.
They're just all great. Hold on, there's more.
Living again without a kidney means you can't eat pizza. That's probably worse than dialysis for me.
My family actually brought me pizza in the hospital, and I swear I got tears in my eyes because I didn't know that was how good pizza tasted.
Seeing him for the first time and he's devouring pizza when I had zero appetite whatsoever, it just was maybe the very best moment of my life.
When the moon hits your eye like a big pizza
You guys are making such a
pie,
difference for the pizza community. Now here's another place, and I want to just show you this.
I ultimately decided to donate a kidney because I knew that God gave me the gift of 2 healthy ones.
God has spoken to my heart and had assured me that everything was going to be okay. He was going to take care of me.
As a Christian, when we speak of the Christian community, you know, we talk about the family of God, and I just felt like if I could or would do it for a family member, then why not for her?
It was something I believe the Lord needed me to do. He gave me this journey to take, and He planted this in my heart.
Me having faith in God, I knew it was something that I was supposed to do.
This was going to be a miracle that God was working through both of us.
My life has actually changed tremendously for the better. You know, I'm very, very blessed, and I feel like when you step up to the plate, when God's calling on you, blessings just flow.
So can you imagine if we were starting to speak to different faith communities, right? This is organically happening. I'm not asking this. This is just what's being said. So can you imagine what we could add then if this was a conversation to happen in those communities? That didn't show up. Show you a couple more, just because they're great.
It's been 11 months since I received a kidney from my wife, and we feel great. We've always been close, but we've become much closer through this whole process, and we certainly have a greater appreciation for our time together now that we have more of it.
Looking back, the best part about donating a kidney was really being able to help Paul to lead a normal life.
I'm the one who gained everything, but for her, it's the opposite.
Is I've become the person that people are in awe of because I saved my husband's life, which makes me extremely embarrassed most of the time.
Don't give up hope. Stay positive, stay active, and again, talk to people that are close to you.
And one more from the donors. Let's see. Okay, here's some.
I donated a kidney 2.5 years ago to my husband.
I received a living kidney donation from my wife.
And I donated a kidney to a very good friend of mine's brother.
I had many questions about how this would affect my wife, Carolyn. Well, how would this impact her physical activity or mental health?
I'd never had surgery, so what would surgery be like?
How can we both do this if we've got kids? Who's going to take care of our kids?
Ask to speak to someone who has been a living donor.
Your team that works with you in terms of doctors, coordinators, social workers are so phenomenal. You can literally tell them anything.
I was surprised at the support I got. I was surprised at the simplicity.
My favorite memory of this entire process and journey is afterwards my wife's friends and the doctors and nurses and the donor staff treating my wife like the hero she is.
So I honor all of these stories, right? These nice people sat at home. You can see sometimes they're rough, but actually from a space where everything is manufactured, this is a story of real life. You can tell even when it's rough, right? This is normal. These are normal people. This isn't like a star with perfect makeup. So I love that about this program. So I want to close, but I also wanted to say a few things. One, if anyone in this room would like to add your story, you are cordially invited. You can share it with anyone. Whatever you'd like to say, this is about making our field accessible to people who may not know a lot about our field. Whoops, I got to go to this. I also want to say some practical things to our providers here. So one of the places that hasn't been named is that we could weave this into Epic or MyChart or places like that. So not only could you get educational material sent to you, you could get stories sent to you about people who look like you that have done this. It's kind of an interesting opportunity. The other part is for media on Facebook, for transplant centers, for community organizations, anywhere. These are supportive kind of posts that we would do on Facebook and Instagram. So we would have these little stories, and then we'd have myths. We would have, different people on this, people telling their story. You could click into it. So it allows for campaigns, for anyone who's doing health communication type campaigns for whatever the agenda of your organization is. This content can be built and then it can be mined for working to serve your community better. So conclusions. First, I'll say a few things. So storytellers need support. We've got to basically build this and then support people to tell this. We have to find ways that, just like every other area, we capture the wide variety of stories from everybody touched by our cause. But this is a really novel way to capture first-person stories. Editing is sometimes needed if there's anything ever that's ethically potentially concerning, so that's something to be aware there. But many storytellers will share a video if it can educate and motivate others. And that, as usual, makes me proud to be part of this field, because we can't keep calm because we're still fighting kidney disease. Great, thank you very much.
That was truly, truly amazing. Thank you so much. We really get all inspired, I think, and are ready to jump and do our videos and share them with you definitively to increase our Canadian stories online. And go Canada. Yes. Do we have time for any question for Amy? Maybe one? Yes, go ahead.
Having an hi, sorry about that. This is really an amazing initiative. Congratulations. And I don't know how long it's been going on in the States, but do you have any evidence that it's making an impact in living donors coming forward?
We're starting to build it. Sorry, I don't know if you need this for taping. We're starting to build it for health educational interventions that are happening in different ways. So it's being tested lots of places, but there was really a sense, let's build the library, let's make it sure it's diverse before we release it. So it was always waiting to capture the diversity of our field before it opened. And then now it's like, how could it go here and here? And people are picking it up and starting to use it everywhere. So this is like next 5 years for sure. If anyone would like to partner with me on testing its efficacy in various ways that you are in, I'm open, and I know that UHN, I think, is probably open too.
Considering that we're in a bilingual country, I'm assuming that one could record it in a story in French.
Yep, I think this would be great. So this immediately came with Spanish for the US. So yes, I think we could build it in many languages, and you could have, the nice part is it's just the prompts and then the people are talking, right? So website and prompts that are in whatever language, yeah.
Just a thought or an idea is that maybe if the healthcare professionals tend to have the same kinds of questions from potential donors or recipients, if you put them up there and invite people who have told their story to answer those questions specifically, that might be a way to.
That'd be wonderful, wouldn't it? Like, we want these prompts to get answered by real people living it. That'd be great. And then you talk about the facts.
Okay. One more? I think we have to, one more or no more?
Thank you
Just
so
the
much.
last question. Okay.
Also, in the frame of thinking about things with respect to narrative and the way in which narratives are structured, I was wondering about those prompts and how those were decided upon, because that's going to shape the story that's
It
told.
is, that's great. We should talk about that. There's lots of thought on the shape of a narrative story. So I got your back, I agree fully. But I'm happy, I'll be at the next event. We can totally talk informally.
Perfect. That's great to hear that you are going to be around again, and everybody can get further inspired or come with new ideas and share them. With this, I think we are going to close the day. I think that it was a great first symposium, and thank you to everyone who came. I'm going to leave the podium to Paulo for the closing remarks, but before that, I have to acknowledge and thank very much Paula for all her work to get the symposium today, as well as her team with Heather and Courtney and everyone else who chipped in and brought their effort to get this first event happening and happening smoothly. Paula and Heather and Courtney, thank you all very much.
I have the easiest job of the day, because my job is to thank all of you for being here. This is our first really big event, and we weren't sure how it was going to go. I think it went pretty well. And I hope you'll join us. Thank you. I hope you'll join us both online for a continued conversation and in the months ahead. And we do plan to have a repeat of these symposiums on an annual basis. This event could not have been organized without the support of many people. As Nazia mentioned, we have a great staff. So I'm going to call a few people, a few groups of people, and I'm wondering if all of you could stand up as I mention. There are too many names to mention, but as I mentioned groups. So I'd like to thank all of the speakers. So if you could stand up, all of the student poster presenters, all of the volunteers who are part of today. I would like to thank our great MC, Nazia Selzner, Dr. Selzner, for running this event and keeping us on track. The staff here at the BMO Center were terrific. The living donors, the patients who shared their stories, it was moving to hear them. And whenever we hold an event, that is what generates a lot of discussion and a lot of questions. And what we heard today is that storytelling matters, and we need to tell more stories, and we need to reflect more experiences in those stories, so that all of our communities connect with those. I also wanted to acknowledge the founding supporters of the Center for Living Organ Donation. So Estella's and the Kearney and Cahill families for supporting today's event, and an event that we're having tonight to honor our living donors. And it will be full of activities, full of fun. Some of you will be going to that event, and I look forward to seeing you there. But I especially want to thank our staff, Heather Lannon, who's here, and Courtney Mart, who is organizing for tonight's event. There have been a number of late nights, and they've been committed and continue to be committed to the center and to organizing many more such events. So thank you very much for being here. Give us your feedback, and we look forward to seeing you next year and at events before then. Thank you.